had taken. They would get long phone calls from Washington, D.C. wanting to know what they had found and why they hadn't found out what the mistake was. And so the third day, I'd gotten to know them pretty well, and I asked them, I said, well, what makes you so sure that Berkeley had any live virus in their vaccine? And he enumerated 2 or 3 reasons. One, it occurred in the same arm, and the incubation period was right. And a third thing, 2 or 3 other things. And when he got through talking, I agreed with him. There's no question in my mind that there was a virus in the vaccine, and that it was there because the method that had been given to us by Dr. Salk was not a perfect method, and the method for testing for live virus was not a good method for testing. And so I came back the next day and talked to Art Beckley, who was our vice president for public relations, and said, we better get out, we're getting the wrong story out by denying that there's any live virus, because it's going to be proved it's in there, and we better get out the story that is the correct one, and that was that we were following the methods that were prescribed for this. And he said, well, are you willing to tell Dr. Bob Cutter and the other 2 Cutter family? I said, well, sure I am. And that night we met at his house at 9 o'clock and kept going till about 1 o'clock. And I explained that I was just absolutely convinced that what they were telling me was true, what the inspectors had told me. And I agreed with them. And the next morning, the day after that, or that morning, the story in the newspapers changed completely, and Dr. Bob released a statement saying just what I had got through saying. What I had not thought about really much at all was that my boss was the one that was telling him just the opposite. And so my boss had absolutely, I didn't realize at the time, but I can understand it now. They had no use for me because I was just raining on his parade and making him look bad. And I never had any good relations with my boss after that. I didn't realize it, though, for at least a couple of years that we went ahead. Cutter took their vaccine off the market. They lost business. Cutter was having a lot of trouble, so they were buying little companies that were manufacturing, trying to build up their dollar volume. They bought a plastics manufacturing company, a small one, and a small company manufacturing medicines, different kinds. Then the vice president for finance came in the office one day and said that a company called Hollister Steer that manufactures allergenic extracts is available for sale. It's been turned down by 6 other companies that are in or related to the allergy business because the allergy doctors are developing a method of giving 1 injection a year for allergy instead of 50. And they figure that will reduce tremendously the amount of vaccine that's being used, and so that the business will go to pot. And I said, well, they're using mineral oil to do this, and mineral oil will cause abscesses and things like that. And I think it's just a fad, and I think they'll sooner or later quit. And I would recommend going ahead and buying a Hollister Steer. And the reason, of course, Hollister Steer made more money per sales dollar than any other, than Cutter did, and any other company of any size except any other small company. So he took, the vice president took my advice to the President's Advisory Committee, which is Dr. Bob, Fred Cutter, and Ted Cutter and himself and one other person, I don't forgotten who it was, but the five of them discussed it and came back and said Dr. Bob, who had practiced allergy and who was something, he was somewhat knowledgeable, said that he thought the risk was too great and that they wouldn't buy it. So he was the seventh big company to. Just at that time, and I swear it was in a week, I read an article in the magazine, in a scientific magazine, a report on the toxicity of various drugs, including mineral oil, which was used in this shot. And from the National Institutes of Health, and it showed that in rats, mineral oil caused cancers. And so I got hold of the vice president first what I did was to call the deputy director of the Division of Biologics, who had been friendly on the inspection. And I said, what about this? How long would it take anyone to ever get approval for a mixture of allergenic extracts that included mineral oil when I read that mineral oil causes cancer in rats? And his answer was, it'll take one human generation. Well, what he was telling me is that it would never happen. But theoretically, if it didn't cause cancer in humans in 35 years, why, that's one human generation. So I went back into the vice president for finance, and he at the executive luncheons was the guy that was always handling the odds on football games and bets on pools and things like that. And so I told him that I had talked with the deputy director, and that my understanding was, and that I had read this article that caused cancer, and that there wasn't one chance in 10 that in 10 years that would ever be licensed to be a product. So it really was nothing you should worry about, and that he ought to call another meeting with Dr. Bob and the rest of the Cutter family. And they did, and they changed their minds, and they bought the company, and the company returned positive money for years and years and years. I had an ulterior motive in that I thought put out a feeler to try and be medical director of the Hollister Steer company that we acquired, but they already had an MD. Cutter was retrenching after the polio incident, and they were letting a number of people go. And I had just been there a year, and I was afraid that I might be let go in spite of contributions I had made. So I sat down and started thinking about what I could do that would really be important to Cutter Labs, and what I could do, what I would like to do or be able to do on the basis of my knowledge. And Cutter was in a number of segments of the pharmaceutical business, and one of them was what's called blood fractionation, where they made a product called gamma globulin, globulin being the protective proteins in blood serum that protect people against disease. And I was remembering from several years earlier, that people who had, soldiers who had been immunized with tetanus, who got a booster injection 5 years later, had huge increases in the tetanus antitoxin content of their serum. And I knew that this would mean that it would be antitoxin in the gamma globulin. I knew that Cutter was in the business of blood fractionation, and that Cutter, part of my job had been to inspect our blood bank operations in prisons like San Quentin, one in Walla Walla, Washington, and one in Arizona. And so that we had a source of veterans, even though they were in prison, who might be immunized with booster doses of tetanus toxoid, trying to get high levels of antitoxin. Now, why do we want high levels of antitoxin or gamma globulin, which I'll call tetanus immune globulin from now because that's the official name? It's because the product that they were using for people that got injuries in the garden, in the yard, in the barn, and who had not been immunized with shots of tetanus toxoid had to be given in the emergency room tetanus antitoxin that was derived from horses. In other words, they had immunized horses back in those days, and that horse serum would then be injected into people. And horse serum injections caused about 20% of those people become sick with serum sickness, which is a very serious illness in itself. Secondly, if they ever had to get another shot of horse antitoxin because they had been sensitized to it the first injection, they really didn't get any immunity. They thought they did. They might think they did, but they didn't really have any immunity. So there was every reason to get rid of the horse antitoxin and to have a product called tetanus immune globulin. Well, I suggested this to my boss, and this is when I learned how much he disliked me for what I had done at the polio time with Dr. Cutter and the family. And he said he wouldn't support my idea of doing tetanus immune globulin. And I was disappointed, but by then I was convinced that it was a good idea, so I went to Ted Cutter, who was a hard-drinking executive vice president of the old company, and explained the program to him. And he was a pretty smart guy. He says, well, even if all you're telling me it doesn't turn out to be any good, we can still call it gamma globulin, less like our regular product that we have all the time. So there's no chance of losing any money on it. I said, that's right. So he said, go ahead. And so I organized a program of injecting people in the 3 prisons and getting their bloods drawn and sent back to Berkeley, as we had done before, but did it with hyper-immunized against tetanus with tetanus toxoid. We then put it through the regular manufacturing process for human fractionation to make a gamma globulin product, and then tested it for tetanus antitoxin content, and it had good amounts. I then went to one of the teachers from the residency days, the director of the Palo Alto Medical Foundation, Dr. Mark Krupp, and asked if he would give injections to 3 people who had never been immunized to tetanus and draw bloods at 15, 30, and 60 days and send it to me, so that I could get data to submit to the Food and Drug, what we now call the Food and Drug. And he agreed to do this, and we found that after 60 days, the people still had good levels of tetanus antitoxin from the gamma globulin, which was twice as good as they would have had with horse antitoxin. So I submitted all of this, submitted the data to the Food and Drug, and they approved it, the product. We introduced the product, and I made the biggest mistake. I never published the results of those 3 persons with Dr. Krupp. And the reason I didn't was I was intent on getting started with my own company, Berkeley Biologicals, and I didn't feel that I had time to write it up. In hindsight, I should have. The other thing I can say was that to make life simple, I didn't try and reduce the dose the human dose of tetanus immune globulin, but I used the regular old horse antitoxin dose, which was twice as much as you really need, because in later years they reduced the dose down to half, to 750 units, which was half, and found it to be entirely adequate. I've said that the tetanus immune globulin is the only product, as far as I know, that it has ever been submitted to the government and approved on the basis of studies in 3 persons. Nowadays, they would require 300 and maybe more. But the human knowledge, our knowledge about immune globulin, gamma globulin, was such, and the knowledge about tetanus antitoxin was such that it didn't take a lot of patients. And the doctors who approve things in the food, in the FDA, or Bureau of Biologic Standards, then were more scientists and not peculiar like the guys that are there now. So I ended up with a product that we sold, I think, only $35,000 worth the first year, but it went on in years to come, and millions of dollars worth of product by Cutter and other companies who began manufacturing it years later. So has been a real great boon to people who have injuries, and I felt very good about it. And I thought nobody else in the world had ever thought of that. And just as we were finishing up, I got a phone call from a doctor whose name I've forgotten, call him Dr. Stewart, from Washington. He said, I'm in Washington, D.C. I'm from the Karolinska Institute in Sweden, Stockholm, Sweden. And I understand that you're interested in tetanus immune globulin. I didn't say, how did you know I'm interested in it? But I deducted that he had visited someone in the Division of Biologic Standards and had talked to them, and they had told him to contact me. But he came out to see me, and he said, well, he had made a little vial, a 5cc vial, just to prove that it could be done. I said, well, congratulations, because I had made a 30-gallon jug of it, and I knew it could be done too. So that I've had to quit saying nobody else in the world ever thought of that. Actually, at least one other doctor had thought of it in Sweden. So that by then I had been at Cutter for almost 5 years. I had been having lunch with Bill O'Neill, who was, quote, the product manager of the company. And one day we were talking over lunch like we usually do, and he said,